Welcome to Lungs Anatomy Part 2, presented by Dr. Vishnu Pal. Let's consider a case scenario. A 13-year-old boy ingested part of a toy while playing. An X-ray showed a foreign body in the right main bronchus, leading to sudden cough and breathlessness. A bronchoscopy was performed to remove the object. This scenario raises several questions. Why is the right bronchus a common site for foreign body lodgement? What is bronchoscopy? Why did the patient experience cough and breathlessness? And what procedure is done for choking? The bronchial tree begins where the trachea divides at the lower border of the fourth thoracic vertebra into two primary principal bronchi, one for each lung. The right principal bronchus is short, about 2.5 centimeters long. It is wider and straighter, or more in line with the trachea than the left principal bronchus. Conversely, the left principal bronchus is longer, about 5 centimeters, narrower, and more oblique than the right bronchus. This slide is focused on the bronchial tree. This diagram illustrates the intrapulmonary blood circulation, showing the pulmonary artery, pulmonary vein, bronchial artery, and respiratory bronchioles interacting with the alveolar sacs and capillary networks. Bronchopulmonary segments are well-defined anatomical, functional, and surgical sectors of the lung. Each segment is aerated by a tertiary or segmental bronchus. Each segment is pyramidal, with its apex directed towards the root of the lung. They contain a segmental bronchus, artery, autonomic nerves, and lymph vessels. There are typically 10 segments on both the right and left sides. This chart and diagram show the anterior and posterior view of the right and left bronchopulmonary segments, detailing the lobes and specific segment names. These illustrations provide a detailed view of the bronchopulmonary segments from the anterior and posterior perspectives for both the right and left lungs. This slide highlights the bronchopulmonary segments. This radiograph shows the radiological anatomy of the chest, identifying key structures like the trachea, clavicle, spine of the scapula, aortic arch, and the dome of the diaphragm. The bronchial arteries provide nutrition to the bronchial tree and pulmonary tissue. The right side has one bronchial artery from the third right posterior intercostal artery. The left side has two bronchial arteries from the descending thoracic aorta. Venous drainage from the first and second divisions of the bronchi is carried by bronchial veins. The right bronchial veins drain into the azygos vein, and the left bronchial veins drain into the hemiazygos vein. For lymphatic drainage, superficial vessels drain the peripheral lung tissue to the hilum. Deep lymphatics drain the bronchial tree into the bronchopulmonary nodes. The parasympathetic nerve supply comes from the vagus nerve. These fibers are motor to bronchial muscles, secretomotor to mucus glands, and sensory for the stretch and cough reflexes. The sympathetic nerve supply originates from the second to fifth sympathetic ganglia. These fibers are inhibitory to the smooth muscle and glands of the bronchial tree. In clinical anatomy, aspiration pneumonia is often seen in the right lung. The right bronchus is wider, shorter, and more vertical than the left bronchus, making it the most common site for foreign bodies to descend and lodge. Heimlich's maneuver is a procedure to remove foreign bodies lodged in the airways, involving back blows and abdominal thrusts. This slide emphasizes the angles of the right and left bronchi with the carina, illustrating the anatomical reason for foreign body aspiration preference. Tuberculosis of the lung is a common disease. A complete course of treatment must be taken under the guidance of a physician. For auscultation of the lung, the upper lobe is heard above the fourth rib on both sides. The lower lobes are best heard on the back, and the middle lobe is heard between the fourth and sixth ribs on the right side. Bronchial asthma is a common respiratory disease caused by bronchospasm of the smooth muscles in the walls of the bronchioles. Thank you for watching this video on Lungs Anatomy Part 2. To answer our first question, the right bronchus is shorter, wider, and more vertical, which is why foreign bodies tend to lodge there. Bronchoscopy is a procedure using a bronchoscope to visualize the interior of the tracheobronchial tree. The cough and breathlessness occur because the foreign body reaches the sensitive carina, triggering the cough reflex, and breathlessness is caused by airway obstruction. Heimlich's maneuver is the procedure done for choking. Thank you.